And start. Okay, I'm going to go ahead and show my card here. And then I'm going to do a survey of the room. I just have a secondary video going just in case technology fails. I'll do another room survey. Okay. All right, we're going to go ahead and get started. I'm going to wash my hands. Hello, my name is Julie Melton. I'm a first-year student in the master's program at Arkansas State University. I'll be performing your exam today. What would you like me to address to you guys today? Morgan. Well, nice to meet you, Morgan. We'll go ahead and get started. I'm just going to go ahead and put my gloves on and then come around here, make sure that this is nice and in view the whole time. Okay, so what we're first going to do is we are going to inspect her respiratory status. So we're going to be inspecting her breathing. We want to make sure that she's not having any increased work of breathing. We want to make sure that she's not having any retractions that would show increased work of breathing. You can see that here on this sternomastoid area here. And then also we want to look at the intraclavicular and make sure that she's not having any retractions. And then we want to make sure that we assess her. We're looking for symmetry of the lungs, make sure that she's having equal expansion. We want to just inspect, and for testing purposes, she has her shirt on, but ideally your patient would be disrobed. And at that time, you could also assess for any masses, lesions. You can assess for any abnormal masses. And then you can ask your patient, are you having any chest discomfort or any discomfort around your thoracic area? No? So if she was, you can go ahead and palpate. So you can just palpate the areas, make sure that she's not having any tenderness. And this would be good in case she had any like pleuritic pain, if she had any costochondritis. She's been having a cough. Sometimes those intercostal muscles can get pretty sore. And then so we're going to move on, and we are going to listen to her. And we're going to listen in the ladder pattern. You take deep breaths out of your mouth for me. Thank you. Thank you. I'm going to skip over the breast region. Take it right here. Thank you. Okay, good. Same thing on the back here. Would you mind turning your legs to that wall for me? Just so they can see. All right, we're going to continue with the ladder pattern. All right, I heard her breath sounds. She was equal. I heard even breath sounds in all areas. She had a normal rate. She didn't have any adventitious lung sounds. I heard her vascular breathing, and it was nice and normal, even. I also wanted to note her inspiratory and expiratory effort. And then also when we were assessing her, we want to be sure that we note her AP diameter, make sure that she doesn't have any barrel chesting or any signs of any type of COPD or anything like that. So everything seems really great. So I'm actually gonna go ahead and percuss her chest. And so I'm gonna take my gloves off, and then I am going to ask her to lay down for me. Okay, and then I can support her legs here, make sure that your patient is always nice and comfortable. So I can move you guys closer just so you can watch the technique. And so we're going to use our middle finger hyperflexed, and we're just going to start percussing. And we want to make sure that we assess for any tympany. We want to make sure that we're assessing for any dullness, and dullness can be indicative of pneumonia. We want to assess for any hyperresonance, which could be if they had a pneumo. And so this is just a good assessment tool that you can use before you send your patient off for any type of imaging if you had suspicion. So then I'll go ahead and ask her to sit up so I can do her posterior. Yep. And then, so same thing here, hyperextend. Okay. She's nice and resonant, and everything was nice, and no dullness and no hyperresonance. And so we are going to go ahead and start on her cardiac. And so we're going to have her lay down at a 30-degree angle here. And I'm just going to support her legs here. And then make sure you guys can see nice and good. And what we're doing here is we want to assess for her carotids and then also for her jugular vein. It's good that we want to be sure that there's not any increased distension of that jugular. So you can ask your patient to turn their head laterally, and you can just go ahead and assess, and you can see the pulsating carotid right here in that sternal notch. I'm just going to go ahead and feel that. And then you can also see her jugular vein here, so you can go ahead and palpate that. I'm going to take a look. And then I'm going to come on the other side and do the same thing. Just have her face laterally. And you can see that on the right side, the jugular vein does protrude more on this side. And then so you can have that tangible white. And I don't really have a way of dimming it, but if I did, I would dim it, which would help visualize that jugular vein. But I can see it really good with the lighting that I have here. So I'm going to go ahead and get a jugular vein pressure here. So I have my measuring tape, and then also I have my straight angle here. So I'm just going to go with that sternal notch, and then I'm just going to where the point where I can't see any more pulsating. Okay, and she's 3 centimeters above that sternal notch, so everything looks nice and good. I don't see any increase in any jugular vein distension or anything that would be indicative of any type of suspicious for any type of heart failure. If you wanted to, you could always test that hepto reflex, where you can press on the patient's chest right here, right below the rib cage, which would displace that free blood. And you should see pulsating of the jugular vein, which would eventually disappear because of the heart compensating for the increase in pressure, but with heart failure, it would still continue to be bounding. And so next what I'm going to do is I'm going to go ahead and palpate for her carotid. And so I'm going to just palpate over here. Just one at a time. And then palpate over here. Perfect. 2 plus, no thrill. And I'm going to go ahead and listen for any type of bruit. So you just go ahead and look laterally over here for me. eyes. Look towards me, please. Wonderful. Okay, she has no bruit noticed. So I'm going to go ahead and while she's laying here, I'm just going to go ahead and go in with the cardiac exam. So I'm going to start with palpating. I'm going to go ahead and palpate the cardiac area, and this you can just palpate, make sure that there is no heart movement that you can feel that's really bounding or pulsating out of the chest. And then while we're here, I'm just going to gently press under this breast, okay? So what we're looking for here is that point of maximal impulse, which you should feel right at the 4th to 5th intercostal space, about mid-clavicular line here. And it's about 2 centimeters in diameter. It's nice and even. Great. Okay, and now I'm just going to go ahead and listen to her. I'm going to start off. We have our aortic area is our second intercostal space to the right sternal border. And then we have our pulmonic valve, which is the second intercostal space to that left sternal border. We have our herbs area, which is right along that left sternal border, about the third intercostal space. And then we are going to listen for our tricuspid area, which is about the 4th intercostal space at that left sternal border. And then we're going to listen for our mitral area, which is that 5th intercostal space, mid-clavicular line. So I'm going to go ahead and listen with the diaphragm. Okay, now I'm going to switch over to the bell. Same areas. Okay, and what we're doing, we're going to assess that rate and rhythm. She had normal rate, normal rhythm, S1, S2 heard, no rubs, no gallics, no murmurs, no additional heart sounds noted. Heart sounds nice and good. It's got a good quality, good sound to it. So we're just going to go ahead and move on. And so then we're going to move on to our peripheral vascular. So I'm just going to turn here. We'll be assessing her legs. So I'm going to have her go ahead and lie flat while how she's lying right here. Are you comfortable? Okay. And so what you wanted to do, let me just adjust this a little bit more. What we're wanting to do here is we want to assess for the size, shape of her legs. We want, it's okay. Size, shape of her legs. We want to know any differences in that calf size, that leg size. We want to make sure there's no tenderness, no masses. While you're down here, you want to make sure that there's no edema. So you'll be pressing on the shin for 5 seconds. No edema noted. No edema. And then also come behind here and press for any edema. No edema. No edema. Okay. So just make sure you also assess the hair distribution. She has nice even hair growth on her legs. Everything looks nice and even. There's no like scaling. There's no coolness. So we were there. We can also assess for that temperature. Everything is nice and warm and intact. We're going to go ahead and check her pulses. So just going to palpate here. Okay. Her femoral. 2+. No thrill. And then check her popliteal. 2+, no thrill. Her dorsalis pedis. 2+, no thrill. And then that posterior tibia. Okay, and same thing over here. 2+, no thrill. And 2+, no thrill here as well. And then also, she has her shoes on, but we would check for that capillary refill, nice and brisk. Good cap refill, less than 3 seconds. Extremities are nice and warm. And we'll also palpate for our lymph nodes in this area. So we have our horizontal and we have our vertical nodes here. So you want to just palpate and you want to assess to be sure that there's no enlargement, no tenderness. Make sure that they are nice and non-tender. You want to make sure that they're a little bit mobile. And then, so her lymph nodes were not swollen, not tender. They were nice and in the area, nothing felt unilateral. So we can go ahead and sit up and we'll do our breast exam. And so for our breast exam, we will be just verbalizing for the most part. So with your breast exam, you want to have your patient undraped and you can assess one breast at a time. And you want to assess for the color, the texture, the size of the pores, if there's any thickness on both of the breasts. You want to assess for symmetry, contour. You want to note if there's any retraction, if there's any dimpling, if there's any lesions or discoloration. And also note the nipple size, the nipple shape, inversion of the nipple. If there's any abnormal discharge from the nipple, bloody discharge would definitely be something to note. And then, so you're going to assess the patient with their arms to the side. And then you're also going to have your patient lift their arms up for this exam. And then you're also going to have them press their hands on their hips, kind of out like that. And then also leaning forward. So this will help be able to visualize the breast in all areas. Going over the same notes that I said from the first. So we're going to look for size, thickening, changes of pores, contour, symmetry. We're going to look for the nipple inversion, retraction, direction of the nipple, any abnormal discharge. So now I'm just going to make sure I inspect the axillary area for any rashes, masses, lesions, or anything that would be abnormal on both sides. And both of her axillary regions are nice and intact, no rashes, no lesions, no discoloration. And we're going to go ahead and palpate for those lymph nodes of the axillary area. Very important to note in your female patient. So we have our lateral here, right on the side of the arm. And then we're going to go in and I'm going to feel, so this might be a bit uncomfortable, I'll be real quick. We're going to go in and do those central nodes right in the middle, the deep. And then move this just so you can see it. So right in here, the deep. And then posteriorly, we have our subscapular right on the back here. You can grab that area. And then we also have our pectoral region. And then we have our infraclavicular here and our supraclavicular. And then same thing on this side. We have our lateral nodes here. And then we have our deep. This is a little awkward. Deep axillary central nodes. And then grabbing from behind, we have that subscapular region. And then we have our pectoral anterior region. And then we have our infraclavicular right under that clavicle. And then our supraclavicular nodes here. Everything was nice, non-tender. Everything was not enlarged. I didn't feel any unilateral, anything suspicious. So that concludes my exam. Okay, thank you so much, and thank you guys.